Hello and welcome to this session, Learning Outcome LO1. Understand the effect of forces. Today, we will learn how forces shape the world of medicine. From movement to medical equipment, forces are essential in healthcare. This video explores the fundamental forces that influence medical practices and patient care. In medicine, forces influence how the body moves and responds to treatment. A force is a push or pull that alters an object's shape, speed, or direction. In the human body, forces act through muscles, gravity, and medical devices. Gravitational force affects posture and balance. Muscular force allows movement and breathing. Gravitational force pulls objects towards the earth, affecting posture and balance. It impacts blood circulation and patient mobility. Falls and posture issues often result from gravitational force. For elderly patients, gravity can lead to fractures or head injuries. Understanding gravity is crucial in patient positioning. Muscular force is generated by muscle contraction, enabling movement and lifting. It acts on bones through tendons, creating joint movement. Weak muscular force makes movement difficult, seen in muscle-wasting conditions. Excessive force can cause strains or joint damage. Proper muscle function is key to mobility. Contact forces occur when objects touch, including friction and reaction forces. Friction is crucial in walking and joint movement. Excessive friction can lead to pressure ulcers in patients. Reaction forces are important in posture and joint loading. Proper management of contact forces enhances patient care. Elastic force occurs when tissues stretch or compress, then return to shape. It's vital for tendons, ligaments, and blood vessels. Elastic recoil in lungs aids breathing. Damage to elastic tissues affects movement and organ function. Understanding elasticity helps in rehabilitation and treatment planning. Balanced forces are equal and opposite, resulting in no movement change. Examples include standing still or sitting upright. In clinical settings, balanced forces maintain stability. They are crucial in patient positioning and equipment use. Understanding balanced forces ensures patient safety and comfort. Unbalanced forces occur when one force is greater, causing movement. Examples include lifting a limb or blood flow. In clinical settings, unbalanced forces explain injuries and movement disorders. Proper management prevents harm and aids recovery. Understanding these forces is key to effective treatment. Forces cause movement, deformation, and injury in the body. They influence walking, breathing, and tissue compression. Understanding these effects aids in safe patient handling. It helps in rehabilitation planning and injury prevention. Knowledge of forces is crucial for healthcare professionals. Medical devices rely on controlled forces for function. Blood pressure cuffs and syringes use applied forces. Stretchers and wheelchairs reduce harmful forces. Incorrect force use can cause injury or discomfort. Proper equipment use is vital for patient safety and accurate results. Understanding forces helps in safe patient movement and treatment. It reduces injury risk and enhances equipment use. Forces directly affect patient safety and outcomes. Knowledge of physics in medicine is practical, not abstract. It is essential for effective healthcare delivery. Forces in medicine influence movement, body function, and equipment use. Gravitational force affects posture and circulation. Muscular force enables movement and posture maintenance. Frictional force prevents slipping, but can cause skin damage. Reaction and elastic forces support joint and tissue function. Gravitational force affects blood flow and posture. It requires the heart to work harder to pump blood upwards. Falls and impacts from gravity can lead to injuries. Understanding its effects is crucial in elderly care. Gravity's role is significant in patient safety and mobility. Muscular force allows the body to move and lift objects. It acts on bones through tendons, enabling joint movement. Weak muscular force complicates movement, seen in muscle-wasting conditions. Excessive force causes muscle strains or joint damage. Proper muscular function is vital for health. Friction resists movement between surfaces, crucial in walking. It prevents slipping but can damage skin, causing pressure ulcers. Managing friction is key in patient care. Excessive friction is harmful, requiring careful handling. Understanding friction helps in patient mobility and safety. Normal reaction force is the support force from surfaces. It allows upright posture by balancing body weight. In medical settings, it influences joint loading and posture. Excessive reaction forces can cause joint wear or pain. Proper management is essential for patient comfort. Elastic force occurs when tissues stretch and return to shape. It's present in tendons, ligaments, and blood vessels. Elastic recoil in lungs aids breathing. Damage to elastic tissues affects movement and function. Understanding elasticity is crucial for treatment and recovery. Applied force is directly exerted by a person or object. In healthcare, it includes pushing wheelchairs and using devices. Controlled application is vital to avoid pain or injury. Proper force ensures effective treatment. Understanding applied force aids in safe patient handling. Force extension relationships show how springs stretch under force. Hooke's law describes this in linear terms. Stiffer springs have higher constants, reducing extension. Understanding these relationships aids in equipment design. Proper spring use is crucial for medical devices. Springs in series have cumulative extensions. The same force runs through each spring. The system becomes less stiff, increasing extension. Understanding series setups is vital for medical equipment. Proper design ensures functionality and patient safety. Springs in parallel support the same load with equal extension. Forces add up, making the system stiffer. Parallel setups reduce extension, enhancing stability. Understanding parallel configurations aids in device design. Proper spring arrangement is crucial for equipment reliability. In conclusion, forces play a crucial role in medicine, affecting movement and the use of medical equipment. Understanding these forces ensures patient safety and effective treatment. From gravitational to applied forces, each type significantly impacts healthcare delivery. Should you have any questions, you're welcome to message us on WhatsApp at 074-8436-1688. See you at the next session. Thank you for your time.